please. Okay, a brief history of the hospice movement. This is very brief. There are many, many volumes of books written on this subject. I always suggest one called The Hospice Movement by Sandal Stoddard, Stoddard. Excellent book. Takes you back to the medieval times. You feel like you're in with the monks and the nuns in their herb garden. I mean, it's an incredible book called The Hospice Movement. Okay, it's called The Hospice. The subtitle is A Better Way of Caring for the Dying. Okay, so throughout time, kind-hearted individuals have always provided care for the dying. In medieval times, for example, travelers on pilgrimage to and from holy places often became ill, and they found shelters in monasteries along the way to the holy places. And the monks and nuns sometimes, often took care of them, especially when they were dying. They had herb gardens. If you read this book, The Hospice Movement, it'll really take you right there. It's excellent, excellent book. So they would, prepare teas from their herb garden and soups and take really loving care of the dying travelers. And eventually these shelters became known as hospice, which is a Latin word meaning hospitium or guest house. And then much later in 1879, the Irish Sisters of Charity in Dublin opened up a hospice in Ireland, and then in 1905 they opened one in London. And then specializing in care for the dying in the modern age was kind of lost for some time. And Dr. Cicely Saunders, many of you may have read about her, she's like the godmother of modern hospice movement. She systematically formulated a way to take care of the dying and their families. Patient and family are one unit. We'll get into that in a minute. She was a nurse who became a doctor. She founded St. Christopher's Hospice near London and wrote many, many books. She was incredible. She really revived hospice care for the dying and the families. Okay, next one is the meaning of hospice care today. Hospice care encompasses a philosophy that embraces 6 concepts. You can read along in your workbook. Death is a natural part of life. When death is inevitable, hospice will neither seek to hasten nor postpone it. That's a myth that we give morphine to everybody and we want them to die quickly. That is not how it goes. Not even everybody gets morphine. Okay. 2, the clinical goal of hospice is to establish pain and other symptom management. 3, hospice recognizes death as a spiritual and physical experience. Psychological and spiritual pain is as significant as physical pain. Let me say that sentence again. Psychological and spiritual pain, which we'll talk about in depth after lunch, is as significant as physical pain. Okay, it's holistic care, the whole person, not just the body, like when you're in the hospital often. You feel like a body in the bed. It's not like that. And 4, the patient, family, and loved ones are cared for as one unit. And family means many things. We're family here. If you were leaving your body, you would have a certain amount of god sisters and god brothers that were maybe closer to you than your family were. I know all my family's gone, they've all passed away, but even when they were here, I have god sisters that are closer than my own sister was. So family has many, many meanings, and hospice recognizes that. Okay, 5, hospice care includes bereavement counseling for loved ones after the death of the patient. It's usually for 13 months. Anybody know why 13 and not 12?
Yeah.
For 1-year anniversaries, it's really heart-wrenching for the family. So they take them through that and then another month. And then if they need more bereavement care, then they usually take you to somebody, they recommend somebody. 6, hospice care should be made available to patients and families in need regardless of their ability to pay. So most hospices should have a fund for those that don't have insurance or aren't qualified for any kind of other assistance. Okay.